everyone, Namaskara. This is the continuation of the video Rasayana for Swastha, and these are the topics which we will be dealing about in this video. Starting with Rasayana Kala, Shloka for Rasayana Prayojana, that is I have already enlisted the benefits of Rasayana in the previous video, and in this video we will be looking into the shlokas which are mentioned in the Ayurvedic classical texts. Then antioxidant and immunomodulatory effects of Rasayana with respect to different research articles. Then lifestyle counseling and its importance, and then last topic is the Urjaskara Rasayana with respect to different age and occupations. Okay, let's begin it with the Rasayana Kala. To get the maximum benefits of Rasayana, when that Rasayana should be administered to a person. So according to Acharya Sushruta in Chikitsasana 27th chapter 3rd shloka, he has mentioned that Purve Vayasi Madhye Va Manusyasya Rasayanam, which means that Purve Vayasi, that is in the younger age, and Madhye means in the middle age, if the Rasayana is administered, then the person gets the maximum benefits of that and lives for a longer period of life. That is Purve Vayasi Madhye Va Manusyasya Rasayanam. Then Rasayana Prayojana, according to the same reference, that is Sushruta Chikitsasana 30th chapter 6th shloka, he has mentioned that Yuvanam Simha Vikrantam Kantam Shruta Nigadinam Kuryuretaha Taminaiva Dvisahasrayusham Naram. It means that Yuvanam, which means that the intake of Rasayana, it promotes the youthfulness. Simha Vikrantam means that person gets the strength as like of lion, that is Simha. Kantam, that is it enhances the complexion of the person. Shruta Nigadinam, which means that there will be enhancement of the memory of the person. Kuryuretaha Kramenaiva means there will be enhancing or it promotes the Kaya, Vak and Manas, means it promotes the physical as well as the mental strength, so that the person gets the commanding nature for everything what the other people do around surrounding to them. So Dvisahasrayusham Naram, that is the person lives for 2000 years. That is the benefits of Rasayana according to Sushruta Chikitsasana 30th chapter 6th shloka. As we have seen the benefits mentioned by Acharya Sushruta in the previous slide, he has given a simile like the person gets the strength similar to like that of lions, and Acharya Charaka has mentioned a wider aspects of benefits of Rasayana as compared to Acharya Sushruta. So let's look into the shloka. Dirgham Ayu Sputi Medam Arogyam Tarunam Vayaha Prabha Varna Swaraudarya Dehendriya Balam Param Vak Siddhi Pranati Kanti Labate Na Rasayanat. It means that Dirghamayu, the person who intakes Rasayana regularly, there will be increase in the longevity, that is the lifespan of the person. Smriti, enhancement of the memory. Meda, that is the intellectual power. Arogya, the person gets the health benefits. Tarunam Vayaha, that is the preservation of youthfulness and the age of the person. Prabha, there will be the increased luster. Varna, Swara, Audarya means there will be increase in the complexion, that the person gets the good voice and the person becomes generous, the generosity increases. Then the Dehendriya Balam Param, the strength of the sense organs increases, the optimum working and functioning and the strength of the sense organs along with the bodily tissues and organs increases. Then Vak Siddhi Pranati, that is the capacity to get accomplished with speaking. He'll get the grip over whatever the person speaks. And Kanti Labate Na Rasayanat, means the overall complexion and the glow of the body enhances. This is the Rasayana Prayojana according to Charaka Chikitsasana 1st chapter 7 to 8 shloka. Coming to our next topic, that is the Urjaskara Rasayana. What do we mean by Urjaskara? Urjas means promotion and prolongation of life, energy and enthusiasm as mentioned in this context. And Kara means which increases. So Urjaskara Rasayana is that which increases the promotion, prolongation of life and which enhances the energy and enthusiasm in the person who intakes that kind of Rasayanas. We know, right, Kara, that is Vata Kara Ahara means which increases the Vata. So Urjaskara means which increases the enthusiasm, energy in that person. So the substances or the drugs which are meant for increasing the longevity and enhancing the immune system to fight against any kind of diseases or to reduce the recurrences of episodic diseases is known as Urjaskara Rasayana. And Acharya Charaka has particularly mentioned Urjaskara Rasayana as a type of Bheshaja, that is the medicine for the Swastha Purusha, that is the person who are healthy. In Charaka Chikitsasthana first chapter, Acharya Charaka has mentioned that Abhayamalaki Rasayana as Swastha Urjaskaram Kinchit. So Acharya Chakrapani has clarified that Kinchit here refers to the Rasayana which we intake primarily elevates the diseases, and then Abhaya and Amalaki. Abhaya is a synonym of Haritaki and Amalaki. These two, the Rasayana of these two drugs predominantly is the best for the Swasthya person. And as I have already said, the Rasayanas can be given for even the deceased person also. And in case of Pandu, that is anemic condition, and in case of Shatakshina, that is the person who in whom that is Dhatukshaya, for that person, in case of Pandu, Yoga Raja, and in case of Shatakshina, Sarpiguda are considered as the best choice of drug according to Acharya Charaka. And Acharya Yogendranath Sen has mentioned that Urjaskara Rasayana as Balavarnadyupachaya Kruta, means Balavarnadi, it nourishes the Bala and Varna of the person, Upachaya Kruta. Coming to the Urjaskara Rasayanas mentioned as per the age. In Balyavastha, the Rasayanas which are predominant of these drugs, that is the Swarna, Bala, that is Siracardifolia, then Amalaki, Jyotishmati and Brahmi. These kind of Rasayanas are given to enhance the memory power of the child and the intellectual power. We know that there is administration of Swarna Bindu Prashana, that is mainly it consists of Swarna, Shodhita Swarna. And then in Yavanavastha, again the Rasayanas which are predominant of the drugs like Bala, Ashwagandha, Shankapushpi and Jyotishmati are given. In the age, a person with the age of 50 plus, the Chavanprash Rasayana, then Pippali, Kshira and Ruta is given according to the Bala and the condition of the person. And Chavanprash, as we know, it is the most popular and the countersign medicine which the persons usually take on their own on an everyday basis. In Vruddhavastha, there are no particular Rasayanas which are being mentioned, as the person will have already taken the Rasayanas during their Balyavastha and Yavanavastha. They will have boosted their immunity and there will be increased Vyadhi Kshamatva in that age also. So there is no particular Rasayanas mentioned, and if they start taking the Rasayanas or Rasayana therapies during that age in Vruddhavastha, the effectiveness of the Rasayana is also not to that extent. So it is better to start consuming the Rasayanas and Rasayana therapies from the Balyavastha and Yavanavastha, so that there is no need to take the Rasayanas during the Vruddhavastha. Then the Rasayanas which are given according to the occupation or the particular disorders. In case of lung disorders or the respiratory system disorders, the Agastya Haritaki, Pippali Rasayana and the Chavanprash is administered. In the digestive system disorders, the Bilva and Chitraka Rasayanas are administered. In the nervous system related disorders or Alzheimer's disease or Parkinson's diseases, means there will be mainly the Vata vitiation in nervous system, right? So in case of that, the Brahmi, Jyotishmati and other Methya Rasayanas are given. And in case of diabetes, Shilajati is best indicated. And in insomnia and Karshya, insomnia that is Nidranasha, the Kshiravruta and Ashwagandha is given. In Ashwagandha, as the scientific name itself suggests, Withania somnifera, means which the person gets relief from Nidranasha by taking the Ashwagandha Rasayana. Then the skin disorders, the Gandhaka Rasayana is given, and in piles, Ballataka Rasayana is given. Then to increase the intellectual power, that is the Medhya Karma, the Mandukapani Rasayana, Panchagavya Gruta and Kalyanaka Gruta is administered. In case of obesity, means the person who for prolonged period of time they'll sit at a place and do their works. For them, there will be deposition of maida at several sites in the body, and which may result in the staulya. So for them, the Triphala Rasayana and Shilajatu along with the particular Anupanas according to the person is given. And in Shatakshina, the Sarpiguda Rasayana, as I have already mentioned. And in Netra Vikaras, the Amalaki Rasayana, Vachagruta Rasayana and the Vijaya Saradi Rasayana is administered. Moving on with our next topic, that is the antioxidant and immunomodulatory effect of Rasayana with respect to different research articles. Here I have considered a research article from Ayush, International Research Journal of Ayurvedic Teachers Association, written by Dr. Santosh N. Belvadi sir, MD, PhD professor from the Department of Kaya Chikitsa, currently working as a principal in DGM Ayurvedic Medical College. Before understanding the immunomodulatory effect and the antioxidant effect of the Rasayanas, we should know what do we mean by immunomodulatory effect and the antioxidant effect, right? So, before indicating a particular rasayana, for example, if you are indicating the Guduchi rasayana in case of prameha, one should know how it acts on different tissues and organs of the body in order to bring that particular effect. So let us understand what do we mean by those terms. First one is the immunomodulatory effect. As the name itself suggests, that is immunomodulator. Immuno, that is the immune system. The substances which modifies our immune system, which helps our body to respond against the diseases. And mode of action, it can act in two ways, that is by stimulatory effect or by suppressing the immune system. So it may bring that particular desired effect of rasayana by stimulating the immune system or by suppressing the immune system also. Then coming to the antioxidant, that is the substances which inhibits the oxidation or which inhibits the reactions promoted by oxygen or peroxide. We know that there are many reactions which will be going on in our body, and there will be many oxidation reaction also and reduction reactions also going on, and which are very much necessary for the growth and development of our body and the tissues. So why do we need this antioxidant property of the rasayana? When it comes to the free radicals, what do we mean by free radicals? The free radicals are the substances or the things which are deficient of energy. So what do we what we do when we are deficient of energy? We grab or snatches the energy from the surrounding cells, thereby the free radicals will get the energy, but it harms and damages the surrounding cells from which it grabs the energy. So it damages that cell and thereby moving on to the tissue or organ day by day and simultaneously. So the free radicals grabs the energy to fulfill its needs but damages the surrounding cells and the tissues. So it is important to inhibit that oxidation process in that case. So antioxidant property of rasayana is also very much essential. Coming to the mechanism of immunomodulators, that is how does the immunomodulation activity take place in our body. We have heard about the words like macrophages, T lymphocytes, phagocytosis earlier, like they are the components of the white blood cells which are mainly responsible to prevent the diseases, right? So the main target of the immunomodulators is the macrophages. It is a large phagocyte which in which some of the phagocytes are fixed and some are moving freely in our bloodstreams. So the main target of immunomodulators is the macrophages. For example, these are the cells of our body. When a pathogen enters our body, these cells try to fight against these pathogens. But how? So these our body cells will produce the effector molecules like the nitric oxide or the cytokine production. Thereby they will generate the cytotoxic T lymphocytes from the WBCs, and they will act against these pathogenic cells which have entered our body to cause diseases. So our body cells will get to know that these cells are not our own body cells and which are the foreign substances which have entered our body to cause the disease. So these cells will stimulate the effector molecules like T lymphocytes and macrophages to fight against these pathogens. In this way, the immunomodulatory action takes place in our body. Mechanism of antioxidant. How does it act as an antioxidant? It acts as antioxidant by preventing the ROS, that is the reactive oxygen species, and removes it before the cell damage. So what is the use after the cell has got damaged? So it is better to teach our body to know our cells and to prevent the foreign substances which has entered the body to cause disease. So it is better to take the rasayanas from the beginning so that the body will get properly trained about protecting its own cells. So it acts by preventing the ROS, that is a reactive oxygen species, and it prevents that cell damage. And it acts as a natural defense mechanism and repairs the oxidative damages. And also it prevents the mutations, that is the chromosomal alterations which in which the one's own person's body cells will only get altered, means chromosomally the cells will get altered, and it will cause damage to the cells of the own body itself, because the cells of the other cells will not get to know that these are our own body cells. They will think that it is the foreign substances because there will be the chromosomal mutations. So we should consume the Rasayana drugs and the Rasayana therapies from the beginning itself so that there will be the proper growth and development of our tissues and the body. To mention few examples of how these drugs acts as the immunomodulatory and antioxidant drugs. Firstly, to take that example of amalaki, it consists of the ascorbic acid, tannins, flavonoids, ellagic acid, vitamin C and etc. There are still many more chemical constituents of amalaki, but still among all these, ellagic acid is considered as one of the powerful antioxidant. So based on that, it acts as the antioxidant property in our body. Then coming to haritaki, that is the main chemical constituents are the glycosides, which consists of the triterpenes, gallic acids, cebulin, cebullagic acid, cebullagic, ferulic, then vanillic acid, and all these together acts as the antioxidant and immunomodulatory action, and these are capable of protecting our cells from the oxidative agents. The third example is of guduchi. It consists of alkaloids, glycosides, phenolics, etc. And mainly these three will produce the antioxidant property. And after consuming the guduchi, we have observed that there is a significant rise in the IgG antibodies in the blood serum. That is 75% of the serum consists of the IgG antibodies, that is immunoglobulin G. So there is significant rise of these antibodies in our blood when we intake the guduchi. Then the ashwagandha, the main constituents are alkaloids, saponins, glycosides, vithanolides and vitaferins, etc. And these all will show the antioxidant property, and there is the increase in enzymatic activity, especially in the brain there given. As I've already said, the ashwagandha is neurotonic, mainly used as neurotonic and in the insomnia conditions. So mainly it acts upon the brain. So till now we have seen the active principles present in a particular drug and how they act on our body. But in general, to mention few major active principles that are present in all the Rasayana drugs, means most of the Rasayana drugs, and how they act. The first one is the alkaloids, that is it acts as a defense chemical agent against the herbivores and to lesser defense against the bacteria, fungi and viruses. Means it gives its maximum effect in case of the herbivores, and it gives a lesser defense against the bacteria, fungi and virus comparatively. And then coming to the tannins, it is the most powerful antibiotic and it acts as the oxidizable substrates and free radical scavengers to protect the cellular constitution of our body. Then the saponins and flavonoids, these also act as an antioxidant property and chelating metal ions, and these are present even in the plant tissues also to protect themselves, means to protect the plant tissues against the herbivores. Coming to the last topic of Rasayana for Swastha, that is the lifestyle counselling. It plays a crucial role in our society to prevent the diseases and to promote the well-being of a person. Why should we go for lifestyle counselling? There are mainly 4 reasons. First one is the disease prevention. Second one, health promotion. Third one, quality of life, to improve the quality of life. And fourth one is the cost savings. For example, a person comes to a physician and for the lifestyle counselling and gets to know that few of the habits which that person keeps following and the things which he consumes or the activities which he does is harming his own body without his notice. Then the physician can guide him, suggest him with respect to that habits and the lifestyle disorders which that person is leading about, and can correct that and bring back to the normalcy. By that way they can prevent some chronic diseases, then they can promote their health by nourishing the body tissues, and then it improves the quality of life, that is it enhances the mental as well as physical structure and the bodily functioning. And of course, when we prevent the disease, obviously there will be cost saving to correct the disease after it has reached to the chronic case. Then there is a point to be highlighted here, that is the ABCD framework for the lifestyle counselling used by the clinicians. That is A. First one, the physician should assess the patient to what extent the patient is ready for the change in their body, mentally as well as physically. Means according to the bala of the person, according to the vaya of the person, according to the rutu, that is the kala anusara, how much the person can change that his being, that should be assessed in the beginning. Coming to the second one is the barriers. See, everything has its own barriers. It can be the economical, psychological or the physical. So a wise physicians should know how to overcome these barriers to suggest some lifestyle modulations for a patient. So second one is to know about the barriers. Third one is to commitment to the one should have that commitment towards his goals. If that person is being suggested for few lifestyle modulations and the dietary habits, that person should fix his mind and determine to follow that commitment. Means if he has his commitment, then he can achieve his goal. Then fourth one is to demonstrate the progress. When everything is properly going, like they are following the dietary regimens which are being set by the physicians, they are following the physical activities, functioning, metabolism, everything as and how the physician has said. When the patient is following that, then there must be that progress. So one should keep an eye over that progress, to what extent it is getting better day by day. So lifestyle counselling is very much essential to prevent the disease and for the well-being of a healthy person. Here we complete the topic Rasayana for Swastha from the first paper of Swasthavritta. Lokaha samastaha sukhino bhavantu. Stay tuned with Adwitiyah. See you all in the next video. Till then, take care. Bye-bye.